line here today.
To an hour or
Guys.
more.
All right, so we are focusing on women this month because it is Women's Month. Of course, I'm a women's
Yes.
healthcare provider. So these are some great programs that are available to the citizens of Arkansas for cervical cancer screening, breast cancer screening, cardiovascular health screening. So lots of great opportunities for patients who are uninsured or underinsured to get the healthcare that they need. So that's great. So tell me a little bit about what does the program look like for a participant? Let's say I am a 40-year-old woman. I am between jobs and I don't have insurance at the moment. And how do I even get to enroll in the program?
Okay, so you'll come to one of our local health departments to enroll in our, like I said, a breast care program. And once you get enrolled into that program, then, like I said, you automatically will qualify for the Wise Woman program if you're between that age group. Upon the first initial visit, we call it that, the baseline visit. We'll do like a health questionnaire, your health history. If you're fasting that day, we'll go on and do your blood work. Like I said, to check for your hemoglobin A1C, glucose, and total cholesterol. If not, we can bring you back for that exam, but we'll just do, like I said, the basic history. We'll do the risk factors, risk reduction counseling. Let's see.
Okay, so
Just
that's all
behavioral
on the
support.
first visit. That's on the first visit.
All in the first visit. We try to capture, right then. We don't want to, anyone to miss an opportunity from enrolling in the program that are qualified.
Okay, so they're getting a hemoglobin A1C, which is a test to screen for diabetes. They're getting their cholesterol checking again on the status of their cardiovascular health. And then what happens after they get that lab work done, Tameka?
So after we get the lab work done, usually takes about 2 to 3 days to get the results back. We always contact the patient. We have to contact them within 7 days to give them their test results. If the test results within normal limits, we'll go on and schedule the health coaching session. So if they don't have any issues with their blood work, everything is fine, everything is normal. We can also do counseling on high blood pressure, abnormal BMI, just things to get them going, exercise, diet. But if those numbers are elevated or alert, we can follow up and we can refer them to an outside provider. And so Dr. Keaton happens to be one of our providers here in Jefferson County. And so, but if they do have a primary care provider already, and then we refer them back to that provider for a follow-up appointment.
That's great. So all of this that you just mentioned to me is free of charge to the patients who qualify. That's correct?
Yes, ma'am.
Okay, that's awesome. So now, do you have to have any medical conditions to enroll, or the eligibility criteria that you mentioned, age, and being a citizen of Arkansas, are those all of the requirements?
Yes, ma'am. That's it. And like I said, once we do the risk reduction counseling, then we'll figure out, if they have any other issues or anything, that we can counsel. But most people, we capture them just with the BMI alone or the blood pressure issue. And so we can do up to 8 sessions of health coaching just for the blood pressure issues. And we do have free blood pressure monitors for the program as well.
Oh, wow. That's great. So you can get a blood pressure monitor from just enrolling in the program. That is amazing. That's an awesome opportunity for women. So really, anybody who wants to take charge of their health, they don't have insurance at the moment, so they haven't been able to get that annual with their primary care physician, they can come see you and see if they qualify for the program. Is that correct? That's
correct.
Awesome.
Yes,
All right.
ma'am.
So
I failed to mention that we do have the Be Well Arkansas program that we can also refer them to. And I'm also a counselor for that, as I mentioned. And so we do have lozenges and patches in-house, and we can also provide counseling for that. So we just kind of tag team at all directions.
Okay, so now Be Well is a program for tobacco cessation. Is that correct?
Yes, but we also offer that to our Wise Women patients as well.
That's amazing. So for all of my audience members who have been thinking, I've got to get 2024 is my year, I got to get on it. Somehow we are already in March. So if you have not made that appointment, gone to your primary care physician for various reasons, like maybe you're in between jobs and you're uninsured, or you can't afford to pay your copay with the insurance that you have, then definitely check out the Wise Woman program. Like Tameka said, you can enroll by going to your local health department in your county, or you can, if there is a provider in your area, we happen to be a provider for Jefferson County, we can definitely refer you over to Tameka. I know for patients we've sent over, they get them in fairly quickly. So that's great. Okay.
Yes.
So tell me, Tameka, how does the program address the issue of nutrition and physical activity for women? What you briefly mentioned about the health coaching that you all do. What does that look like for the
Okay.
participants?
We just kind of talk about like the different food groups, like incorporating fruits, vegetables, proteins, your whole grains. We talk about portion sizes, calorie intake, reading labels, reducing your sodium in your diet, just controlling your hunger, just different ways to just kind of manage that, because you just be surprised. Some people just say, I've never been told that I, need to avoid this, or I should eat that, or so just kind of small changes, we try to give them, a little bit at a time.
Yeah.
Baby steps.
That's great. I'm an obesity medicine physician. I'm also a gynecologist. So I see a lot of patients who come in, even just for their well women exams. And a lot of my patients happen to be patients who are self-pay, who sometimes can't afford to, get continuous care and get the coaching that they need from a nutrition standpoint. So I'll definitely refer patients, over to you all when I see those patients. Now that I know that that's because I didn't actually know that you all did that. That's awesome.
Yes.
As far as counties, what counties are you over in Jefferson County? I
Okay.
mean,
So I,
in Arkansas, rather.
okay. So I work in Jefferson County, Deshae County, Dumas, Deshae County, McGee, and Lincoln County, Star City. But we have wellness nurse counselors that work out of several other counties like Poinsett, Craighead County, Madison and Washington County. That's in Northwest Arkansas, Ouachita, Hempstead County, Nevada County, and as I mentioned, Jefferson, Deshae, and Lincoln for me. So we have several counties in the state.
Okay. Tameka, you mentioned that you all do look at some quality metrics to see how you're doing as far as enrolling participants. What are some of those quality metrics that you look at when you're evaluating how well the program's doing?
Okay. I got a little information from our program manager this
Yeah.
morning, which she stated that like 43.5% of the Wise Women participants with known hypertension achieved or are currently maintaining their high blood pressure due to this program for the second year. 34% monitors their blood pressure at home, and 93% of the Wise Women participants were screened by a provider. And we're doing like a multi-disciplinary team approach for those patients. So
Okay. So what does that team look like? I know, you are the nurse educator. What are some of the other team members that are part of the Wise Women program?
So it'd be with, myself, the provider, that would be you,
Okay.
the pharmacist. We do let them in a direction, like if they can't pay for their medications, we do let them know about different programs that help assist with those. And so, like I said, we just do a whole community team-based approach to assist these patients.
That's great. So really, we really just need to get the word out, because some people don't even know that they have access to all of this. And people fall on hard times. Times are definitely hard right now. So I know there's a lot of people who maybe previously didn't think that they needed something like this. Maybe they had that care with their primary care physician, but they can't afford to pay a copay now. So this is definitely a great way for them to make sure there's no gap in their health. So we want to provide women with all of these opportunities, because we know that a lot of them work so hard that they don't find the time to take care of themselves. So
Absolutely.
that's great. That's great. So how can we as providers, if there's any providers that are listening in, how can providers assist with the Wise Women program to help get that mission to take care of the women of Arkansas expanded?
Okay, so like I said, first we have to sign them up for breast care. So if you are not a breast care provider, then you can refer them to the local health unit to get signed up for breast care. And so we'll start that on our end. But if you are a breast care provider, you just refer them to us just for the Wise Woman program only. You know, if they already have a provider that's taking care of all their needs, you know, we're just here to assist with the counseling part, the health coaching, and things like that. So it's just kind of a back and forth. Just all depends on the circumstance or the situation.
Okay. So as Tameka mentioned with the Wise Woman program, actually with the breast care program, some of your local providers, which I happen to be one of them, we can actually enroll patients into the program. And then if they need that additional care, we can refer them over to the health department to enroll for Wise Woman. And I've actually done this process for some of our patients, and it's a very easy and streamlined process. You know, a lot of stuff sometimes can be complicated when you're dealing with government and grants and things, but I have to say that the breast care program and the Wise Women program has been very easy for us to get patients into, and they've gotten really good care and great communication. What are are there any upcoming initiatives that you're aware of that Wise Women is doing that people can participate in? Anything you want to just kind of get out there?
We don't have anything as of now, but we do try to get out in the community, you know, anytime there's a health fair or anything like that in the community that I'm aware of, I try to come out and educate, give information about the program, because as you stated, a lot of people don't know, you know, they know about the other programs that we have with the health department, but they don't know about these programs. So just really trying to get the word out, any opportunities that we can get to go out in the community to spread the word, then that's what we do.
Do you have any success stories that you want to share with us for some participants that have been just kind of, it can be just anecdotal information about some participants that have participated in the program and some of the success they've had?
Yes, actually, I've had several participants that were like borderline diabetics, or they've been told that they were pre-diabetic. Actually, got their A1C down just due to the health coaching sessions, you know, talking about diet, explaining them about the importance of a healthy diet and exercise. And so they were able to get their A1C down. And it was just how the change happened so shortly between our first baseline visit and then 3 months later, where we did the follow-up and we did check the A1C again. It had changed drastically. So I've seen that in several other patients. Also with the blood pressure issues, we've had patients who weren't on medications or anything, and we referred them out, and they were able to go out to an outside provider and get prescribed medications for blood pressure issues. And so when they came back for their next couple of visits, we can just see the trend of where their blood pressure was starting to go down. So
Yeah,
several successful stories.
that's great. You know, as we know, cardiovascular disease, hypertension, diabetes, all of those things are things that kind of put a strain on our cardiovascular system that can really lead to bad outcomes. So it's great that you're catching these things early on, kind of doing some preventative health coaching and helping patients to keep from having those things happen. About how patients can contact you, we'll be happy to share it with our audience.
Okay. Like I said, I am stationed at the Jefferson County Health Clinic 2 days a week on Tuesdays and Thursdays. The other days I'm at the other counties, but you can contact me by calling the Jefferson County Health Clinic, or you can call my work cell phone number at 870-308-2998. Again, 870-308-2998. If you just have any questions about enrollment to see if you qualify, just give me a call and I'll get back with you, and we'll get the process started.
Okay, sounds good. And we will definitely share that information on our social media. And thank you again for joining us and telling us about the Wise Women program.
Thank you for having me. You have a great rest of the day.
Okay, you too. Bye-bye.
Bye.